thank you everyone for coming. Like Ken was saying, I can't believe this is our 10th talk. It's been an exceptional partnership, and we're really excited to be able to put on these community talks because, as Ken was saying, it is really important that information gets out there about anxiety, about mental health issues, about issues of depression, because there is a lot of misinformation, a lot of misunderstanding about the condition. So part of this is about really educating people and helping people get a better understanding of what exactly anxiety disorders are. Today's talk, if you're looking for, 5 simple steps to overcome anxiety, this is the wrong talk for you. I think that type of approach tends to trivialize and minimize the seriousness of anxiety disorders. If it really was as simple as doing 5 simple steps, then nobody would choose to have anxiety. So tonight's talk isn't about, eat more bran or get more exercise and you'll feel less anxious. Tonight's talk is really about understanding what the anxiety disorders are really about. And I want to think about this talk as sort of consisting of 2 parts. The first half of the talk is what I refer to as the what. What are the anxiety disorders? What are some of the characteristics of anxiety disorders? And the second half of the talk is the part I find more interesting, which is the how. How do these anxiety disorders actually work? What are the mechanisms that underlie the anxiety disorders? Because even though they may look very different, they function in a very, very similar way. So let's start with talking about what anxiety actually is. Oh, before I start, I should point out we're doing something different, a little different this time. We're actually doing an experiment where we're live streaming this talk on Facebook right now. So if anybody's watching on Facebook, hello. Just as another way of trying to get the information out there to as many people as possible. So I just wanted to say that before I got too much into it. So let's talk about anxiety. What exactly is anxiety? The first thing I want to point out is that anxiety is a normal human experience. Everyone experiences it. Everyone has anxiety at some point. And it's actually quite adaptive and quite necessary for survival. For example, people who don't have anxiety don't last very long. So in primitive times, caveman's walking down a path and a saber-toothed tiger jumps out at him. The caveman who was anxious and afraid of the saber-toothed tiger and ran away, he went on to procreate. The caveman who saw the saber-toothed tiger and thought, ooh, cute, and walked up to it, got eaten and didn't last very long. So anxiety is absolutely necessary to help us be safe from threatening or dangerous situations. It occurs on a continuum from low levels of anxiety to high levels of anxiety. It's not like an on or off switch. So it's not that you're anxious or you're not. You can be anxious on a continuum and on a spectrum. And anxiety is a normal human experience in response to life circumstances. So transitions and life changes. So it's pretty normal for people to be anxious about major life events like parents who are just about to have their first child. It's normal to be anxious about that. Children going from elementary school to high school. That's a pretty normative experience to have anxiety. So the point of this is that not all anxiety is bad and not all anxiety is a disorder. And we tend to live in a society that tends to over-pathologize human emotion. If you ever experience anxiety, well, you shouldn't experience anxiety, so let's try and shut that down. Well, there's lots of times where it's pretty normal to experience anxiety, and that's not problematic. So when does anxiety actually become an anxiety disorder? Well, it's when the anxiety is prolonged and causes significant distress or disruption in a person's life. Essentially, when the anxiety is excessive given the circumstances that the person is experiencing. And with anxiety disorders, it tends to either cause the person a lot of distress or cause the person a lot of functional impairment or interference in important aspects of their life. So things like work, school, social relationships, that sort of thing. So I'll reiterate the key point that I made earlier. Being anxious isn't the same as having an anxiety disorder. So people can experience anxiety, doesn't mean there's something wrong, doesn't mean it's a disorder. So how common are anxiety disorders? I use this slide to sort of point out just the prevalence of anxiety in our society. In any 12-month period, 14% of the population will experience an anxiety disorder. Now, again, that's an anxiety disorder, so problematic, interfering, intense anxiety conditions. So to put that in perspective, that means at this moment, as I'm giving this talk, there's just under 25,000 people on the North Shore who meet diagnostic criteria for an anxiety disorder. So that's a staggering number of people, and it just gives a sense of the scope of these disorders. Lifetime prevalence for anxiety disorders is 20%. So 1 in 5 people at some point in their life will experience an anxiety disorder. That's a lot. That's a lot of people who are suffering from conditions that, for the most part, aren't really well known, aren't really talked about very often. So we're going to talk about different types of anxiety disorders tonight. And so these are some of the anxiety disorders I'm going to be describing and discussing some of the characteristics. So things like specific phobias, panic disorder, social anxiety disorder, generalized anxiety disorder, obsessive-compulsive disorder, and post-traumatic stress disorder. So you may have heard some of these terms before. You may have a pretty good sense of what some of the conditions are. They may all be mumbo-jumbo to you. So hopefully tonight you'll get a better understanding of what these conditions look like and what are some of the characteristics of these conditions. It is important to note that these anxiety disorders do not exist in isolation. So it's not uncommon for somebody to experience more than one anxiety disorder at a time. So it's not uncommon for someone to have, for example, generalized anxiety disorder and panic disorder at the same time. It's also very common that anxiety disorders co-occur with depression as well. So let's start with specific phobias, because these tend to be the simplest to understand exactly what's going on. So essentially, a specific phobia is excessive fear and avoidance of a particular object or situation that causes the person significant distress and interference in their life. So there's various subtypes of these specific phobias. So specific phobias of animals, like fears of spiders or insects or dogs. Natural environment, fears of heights, fears of water. Situational phobias, fear of motor vehicle travel, blood injury injection phobias, and other types of phobias like choking and vomiting. Now, I will point out that just because you're anxious about something or something makes you anxious, like, for example, I'm not a big fan of spiders. Don't like spiders, they kind of scare me. That's not a phobia, right? Because it doesn't cause me significant amounts of distress, doesn't lead to any significant impairment or interference in my life. What happens when I encounter a spider is I do what pretty much anybody in my situation would do. I call my wife to come and deal with it. No distress, no interference, it's not a phobia. So just because you don't like something or something makes you uncomfortable doesn't mean it's a phobia. What we talk about as a phobia is it has to cause a lot of distress and it has to lead to some functional interference in your day-to-day life. There we go. The anxiety comes on relatively quickly when exposed to the feared or phobic stimulus. So I come into contact with a dog. If I have a fear of dogs, almost immediately I'm going to experience anxiety. Now, this anxiety may take such an extreme form that it might actually lead to a panic attack. And so you can have panic attacks in the context of a specific phobia. So as a result of the intense anxiety that's caused by exposure to the feared object or item or animal. A person will try to escape the situation, try to avoid the situation, or if they have to stay in the situation, they'll tolerate it, but have to experience a lot of distress while they tolerate it. Now, interestingly, only about 12 to 30% of people who experience specific phobias actually seek out treatment. Reason for this is that, for the most part, people just can learn to live their lives around their phobia. So if I have a fear of heights, well, I just won't live in the 30th floor penthouse apartment. I'll live in a townhouse that's on ground level. And so people just sort of learn ways of living their lives around the phobia. Now, panic disorder. Panic disorder is defined by the presence of recurrent, unexpected panic attacks. Now, the panic attacks are essentially a sudden rush of intense fear or discomfort. And in panic disorder, they usually come from out of the blue, when a person's not really expecting them, at a time when a person isn't expecting them. So the difference between a panic attack in, say, panic disorder versus a panic attack in a specific phobia, in a specific phobia, I'm afraid of dogs. I encounter a dog, I experience a panic attack. It's the exposure to the dog that's causing the panic attack. In panic disorder, I'm sitting at home watching TV, and out of the blue, I have a panic attack. So it's the panic attacks come on suddenly, unexpectedly, and the rush of anxiety tends to come on pretty quickly. So we're talking about it reaching a peak in about 10 minutes. And it's associated with a number of really intense physical sensations. And these are some examples of some of the physical sensations that people experience when they're having a panic attack. Racing heart, shaking, shortness of breath, hyperventilation, numbness or tingling. A lot of times it's numbness or tingling in the face or in the hands or feet. Stomach distress, nausea, hot flushes, a sense of what we call derealization. It's almost like things seem dreamlike, or depersonalization, almost feeling like you're outside of your body. So you can imagine if you're just sitting at home and out of the blue you suddenly experience a bunch of these physical sensations come out of the blue, it's probably going to be pretty scary. And so these physical sensations, when they come on in a panic attack, are usually accompanied by a lot of fearful thoughts. So, what if I'm dying? What if this is a heart attack? What if I'm having a stroke? What if I lose control? I'm having a panic attack and I'm driving on the highway. What if I lose control of my vehicle and it crashes? What if I'm going crazy? What if I'm losing my mind? What if I faint and I pass out in this situation? So you can imagine having those types of fears. You feel the sudden rush of intense fear and anxiety, and you think you're having a heart attack. That's a very scary experience for people. And if this is happening recurrently, if it's happening sort of all the time and frequently, it can cause a lot of problems for a person. So it's essentially like, the way I like to think about panic disorder is it's like someone has set off a time bomb, and they've put this time bomb inside of you, but the time bomb's set to random, so you don't know when it's going to go off. And so it can go off at any time. So there's a lot of what we call anticipatory anxiety, a lot of fear of when that next panic attack is going to happen. And there's also a lot of fear about the implications of the panic attacks. So I'm having frequent panic attacks. What if one of these days it's actually going to trigger a heart attack for me? So with panic disorder, it's not just having a panic attack. It's about the fear about having further panic attacks. So panic's almost like, one way of thinking about it, it's anxiety about anxiety, or anxiety about the physical sensations of anxiety. And this is what distinguishes panic attacks from panic disorder. About a third of the population will have a panic attack every year. That's a lot of people. So 1 in 3 people will have a panic attack every year. That's not panic disorder. Just having a panic attack in and of itself doesn't constitute panic disorder. It's that fear of when the next one's going to happen, and the anticipatory anxiety and the worry about the implications of the panic that causes panic disorder. So panic disorder, it's characterized by a variety of behavior changes as a result of these panic attacks. So avoidance of activities or substances that a person fears could provoke another panic attack. So people will often avoid drinking coffee because coffee gets my heart going, and I don't want to trigger anything, so I'll avoid coffee. Avoid alcohol. People will avoid driving or limit their driving in certain situations. They may avoid driving on the highway because if I have a panic attack on a highway, that could be catastrophic. Avoiding things like exercise or taking hot showers because it brings on physical sensations that are similar to what a person experiences in panic. So essentially, panic disorder is characterized by a lot of avoidance of physical sensations that a person experiences in a panic attack. And in about a third to half of cases of panic disorder, people will experience agoraphobia. And essentially what agoraphobia is a fear, it's a fear of situations or places in which escape may not be readily available if I start to feel a panic attack coming on. So either escape or help may not be available. So any situation where I feel stuck or trapped, and what would happen if I had a panic attack in that situation. So people will avoid crowded places like malls, concerts, theaters. If they're sitting in a theater, they won't sit in the sort of the middle of the row, because if they start having a panic attack, it's hard to get out. It's hard to escape. People will avoid being out of town. They like to stay close to home because home is safe. And so if I travel too far away from home, what happens if I start feeling unsafe or I start feeling panicky and I can't get to my safe place right away? Bridges are a really common source of avoidance. If you're on a bridge, say in traffic, and you start having a panic attack, you're stuck. You can't go anywhere. You can't get help. You can't escape the situation. You are stuck there for the duration of the panic. And being far away from home. People will often avoid things like hiking, right? If you're out on a hike and you're 20 kilometers up the mountain and you start having a panic attack and you want to try to get to safety, it's going to take you a while to get safety or to get help. Social anxiety disorder is essentially persistent and excessive fear and anxiety in social or performance situations in which a person fears that either they're going to do something to embarrass or humiliate themselves in front of other people, or in situations where people, which they fear that people may judge them or evaluate them really negatively. So examples of these types of feared social situations is what I'm doing right now. So for a lot of people, public speaking is extremely anxiety-provoking. And where it becomes sort of social phobia is when it leads to interference in a person's life. So maybe a person's job prospects are limited because they have difficulty giving presentations at board meetings, and so they won't give presentations at board meetings. A student who will avoid taking classes that involve doing oral presentations. And so they'll avoid these types of situations because it's very anxiety-provoking for them to be in a situation where maybe they start, bumbling over their words, or people start looking at them and thinking, this person doesn't know what they're talking about, or evaluates them in a really negative way. And that is a very scary prospect for a person with social anxiety disorder. Other examples of situations that are anxiety-provoking for people with social anxiety: parties, meeting new people, dating situations, asking people out on dates, being assertive, making requests of people, refusing unreasonable requests from people, being very fearful about doing those types of things because what will this person think of me? What if they're upset with me if I say no, or if I ask them to do something? So in social anxiety, the fear is immediate and tends to be sort of relatively severe when the person enters the social situation. There's often also severe anticipatory anxiety. And what that means is a person with social anxiety disorder anticipates the party that they're going to on Friday. And for the whole week, they're going to be worrying about it and anxious about it and thinking about what it's going to be like, and essentially working the anxiety up. So someone with social anxiety disorder isn't anticipating the party on Friday night and thinking, ooh, this is going to be really fun, or I can't wait to meet a whole bunch of new people. They anticipate that it's going to go badly, I'm not going to have anybody to talk to, it's going to feel really awkward, and they anticipate that leading up to the party. So the anxiety isn't just constrained to when they're at the party. The anxiety consists of that whole period of anticipatory anxiety as they anticipate what's going to happen as they go to the party. And when they're at the party, they're engaged in, say, a conversation with somebody. But they're so anxious about how they're coming across, their focus is on what's going on inside of them. The focus is on the anxiety themselves. So it's actually quite difficult to engage with other people and to actually be in the moment and be in the conversation because they're so inward focused on all of the anxiety that's going on inside of them. And worrying about, oh my goodness, I'm feeling beads of sweat on my head. Is somebody, are they noticing? Or my hands are shaking. Are they noticing? Are they are judging me negatively? And they're interpreting what the other person's doing through this lens of their anxiety. So if the other person yawns, it's, oh my goodness, I'm boring them. When it could be the other person yawned because it's 11 o'clock and they were up early that day. So a person is interpreting all of these situations almost through a lens of their own anxiety in the situation. And so they're getting this information about how they're performing in the situation, and they're evaluating themselves in a really negative way. And then what tends to happen is people will often perform what I call a postmortem, is after the social situation, they then go back and rehash and think about how it went, and they often interpret everything that happened that night badly. Again, because they were interpreting everything through the lens of how they were feeling and their anxiety. And so they're going to, when they remember the social interaction, they're not going to remember the 15 people that smiled at them or who they had a pleasant conversation with. They're going to remember the 3 people that yawned or who sneezed or who excused themselves to go to the washroom because I must have been terribly boring. So that postmortem, as they review it, tends to negatively impact their perception of how they perform in the social situations, which leads them into the next social situation anticipating that it's going to go badly because I'm terribly socially unskilled, which furthers the anticipatory anxiety, and off you go. I just make a point in there that a lot of people are shy. Shyness isn't the same as social anxiety disorder. Generalized anxiety disorder, GAD, is essentially excessive, difficult to control worry about a range of different topics. So in generalized anxiety disorder, a person is sort of commonly referred to as the worry wart, the person that worries about everything, or worries about a range of things. So the important thing to point out with generalized anxiety disorder is that the worry isn't sort of weird or bizarre. It's not like people with GAD are worried about aliens coming down and abducting them. They worry about things that everybody worries about. Finances, their job, their relationships, their friendships, minor matters like punctuality, health, their health, the health of other people. So it's not that the worries are obscure or bizarre, it's just that the worries are intense. And there tends to be a wide range of the worries. And the worries tend to be what I call sticky. So in other words, once a person starts worrying about it, it's very difficult for them to stop worrying about it. And the worry in generalized anxiety disorder tends to be chronic. So it's more days than not. It's for at least 6 months. But for a lot of people with GAD, they'll often tell me, I've been a worrier my whole life. And because of the chronic nature of this worry, it's characterized by physical symptoms as well. So things like muscle tension, restlessness, difficulty sleeping, fatigue, impairments in concentration, irritability and anger, those types of things. What fuels generalized anxiety disorder is discomfort with uncertainty, something we refer to as intolerance of uncertainty. People with GAD really don't like the unknown. They like to be in control. They like to know what's going to happen. Any little bit of uncertainty will cause high levels of anxiety for people with uncertainty, or people with generalized anxiety disorder. GAD is often associated with other mental health conditions like depression, anxiety disorder, substance use disorders. People will often use things like alcohol to cope and to manage with the worry and with the anxiety that results from the worry. It's also common to see stress-related conditions in people with generalized anxiety disorder. So things like headaches, stomach problems, irritable bowel, that type of thing. GAD is the second most common mental health condition that presents in primary care settings after depression. So it's a very common condition that affects a lot of people. That leads us to OCD. People often hear about OCD. OCD isn't about being a clean freak. OCD isn't about being particular. OCD isn't about having to have things tidy and organized. OCD is a condition that's characterized by high levels of anxiety resulting from either obsessions or compulsions. These obsessions or compulsions cause a fair bit of distress for the person and interfere in that they take up a lot of time. So at least an hour a day where a person's either obsessing about something or engaging in compulsions to manage the obsessions. Which leads us to what exactly are obsessions. Obsessions are unwanted or intrusive thoughts, images, impulses, urges that are nonsensical to the person or are repugnant to the person, but they just can't stop having them. So these aren't thoughts that a person wants to have. These aren't thoughts that a person's intentionally thinking. They're unwanted intrusions that cause a lot of distress for the person. And they're not just thoughts. They can be images, and like I said earlier, they could be urges. So here are some examples of common obsessions. Contamination. People often think of that one when they think of OCD. Excessive doubting, need for symmetry or order, aggressive or horrific thoughts, or urges. I'll often see, I've worked with a number of clients where one of the things that really freaks them out is they're on the SkyTrain station and they're standing behind someone and the SkyTrain's coming and they actually feel like an urge to push the person in front of the oncoming SkyTrain. And that terrifies them because it's different than a thought. It's not that I'm thinking it. It's almost like I have this urge, and does that mean I'm likely to do it? The answer is no. It's just like having a thought. It's just like having an image of it, but there's something about the urge that makes people with OCD especially uncomfortable. Unwanted sexual thoughts, sacrilegious thoughts or images. And sometimes you can get combinations of these two. So you can have the person who who's Catholic, who's at church, and is getting these intrusive thoughts of having sex with the Virgin Mary in church. Oh my goodness, oh God, get that thought out of my head. Why am I thinking it? So you can see that these thoughts can be highly repugnant, highly scary, highly upsetting to people because they don't understand why they're having it. They don't want to have the thoughts, but the thoughts keep coming up. People can spend several hours a day preoccupied with these obsessions. And because the obsessions are so unwanted, so repugnant to the person, there's a desire on the part of the person to try and resist or to try to get the obsessions out of their head, to try and neutralize the obsessions. And this can take the form of avoidance of triggers. It can take the form of trying to distract themselves, or it can take the form of engaging in compulsions to try to neutralize the thoughts. And that leads to what compulsions are. Compulsions are behaviors or mental acts that a person feels driven to do and to perform over and over again to try and neutralize the obsession. So compulsions are designed to help reduce anxiety. So if I have contamination obsessions and I've touched a doorknob and I feel that my hand's contaminated, I'll want to engage in compulsive hand washing to help reduce the anxiety or the distress and to feel like my hands are no longer contaminated. Compulsions can also take the form of trying to prevent something bad from happening. It's that whole, step on a crack, break my mother's back thing. So I'm concerned that I have an obsession that I've left the toaster oven plugged in, and that's going to burn down the house. So now I have to engage in the compulsive checking of going back to the house and ensuring that the toaster oven is unplugged. Otherwise, the house may burn down. Compulsions are often performed according to rigid rules or in a way that a person feels it's just right. So, for example, I used the earlier example I had of the person who has the religious and sexual obsession about having sex with Mary in church. They may feel a compulsion that they have to pray in a certain way, and that prayer has to feel just right. It was genuine, and it just felt just genuine and real, and it's not. And so God is really going to accept it. And so they often have to repeat the mental compulsion again and again and again until it feels like I've done it just right. The thing about these compulsions, and we'll be talking about this more in a bit when we talk about just the mechanisms of anxiety, is that the compulsions lead to short-term relief, but they often perpetuate the long-term maintenance of OCD. So common compulsions, things like washing, cleaning, ordering, counting, touching, tapping, mental rituals. Thing with OCD is, again, contrary to media portrayals of it, people with OCD are most likely to carry out their compulsions in private. They're not doing it for display because they're aware that for a lot of them, they're aware that it's uncomfortable and they don't want to be doing it, and they know it looks weird and they know it feels weird and they don't want people to judge them, so they're not doing it out and about amongst other people. They're often doing it alone, and they're often doing it in privacy because there's a whole lot of shame associated with engaging in these compulsions in response to the obsessions. All right. And that leads us to post-traumatic stress disorder, or PTSD, which is essentially a collection of symptoms that occur in response to one or many traumatic events. Now, it's very common for people to experience a lot of these PTSD symptoms shortly after a trauma. So in the few weeks after a trauma, it's very common for people to experience PTSD-like symptoms. That's normal. That's not an anxiety disorder. What makes it PTSD is when those symptoms persist at least at more than a month after the trauma is over. So the symptoms tend to fall into four categories, and I'll be discussing each of these. The first is re-experiencing symptoms. And these tend to be the prototypical PTSD symptoms that people often think about. So the recurrent intrusive thoughts or images of the traumatic event, nightmares about the trauma, experiencing flashbacks of the traumatic event. Now, flashbacks aren't just vivid memories. It's almost like, for some people, it can go to an extreme of a dissociative response, where if I'm experiencing a flashback, I'm not in this room. I'm actually back on the battlefield experiencing those mortars blowing off around me. So I lose track of where I actually am and perceive myself back there at the time of the traumatic event. Now, it's not always that extreme. Sometimes it can take the form of sort of sensory flashbacks. So I get triggered to a reminder of my motor vehicle accident, and I smell the smell of gasoline. So there isn't gasoline around, but I actually smell it. That's sort of an olfactory flashback. So another type of re-experiencing symptoms are psychological distress or physiological reactivity to triggers or reminders of the trauma. So anything that reminds me of the trauma is going to make me feel really anxious, really upset, really angry, or cause panic or anxiety types of sensations. So it's not uncommon for people with PTSD to have panic attacks as well. Again, the difference between panic attacks and PTSD is that they're triggered by trauma triggers, whereas in panic disorder, they're untriggered out of the blue. Second cluster of symptoms in PTSD are avoidance symptoms. So avoidance of thoughts, feelings, memories associated with the trauma. So suppressing thoughts or memories of the trauma by trying to push the thoughts out of a person's mind, trying to suppress with things like alcohol or drugs, trying to get those thoughts out of my head. Another form that avoidance takes is avoiding external reminders, external triggers of the trauma. So avoiding people, places, conversations, activities, objects, situations that remind me of the traumatic event. Third cluster of symptoms in PTSD is something called negative alterations in cognitions or mood, or just the way it changes the way a person thinks about themselves, the world, other people, and the way it affects a person's mood. So some of these symptoms include difficulty remembering important aspects of the traumatic event, negative beliefs and expectations about myself, the world, other people, tending to see myself as maybe now broken or flawed somehow, or seeing the world as a dangerous place, or seeing people as being untrustworthy. Distorted beliefs about the cause or the consequences of the trauma. Persistent negative emotional states, so feeling fear, anger, guilt, shame much of the time. Decreased interest or participation in activities that a person used to enjoy doing. Decreased sense of connection with others, a sense of detachment or estrangement from other people, feeling like they can't relate to others or that others can't relate to them. And emotional numbing, which is sort of a difficulty experiencing pleasant emotions like happiness, joy, satisfaction, that sort of thing. So I'll be working with a parent with PTSD, and they'll say, I'm interacting with my child, and I know I should be enjoying it because they're enjoying it and they're having fun, and I know it should feel good, and I know I should feel happy doing it, but I'm feeling nothing, and I'm just sort of going through the motions. That's that emotional numbing. And the fourth cluster of symptoms are hyperarousal symptoms. Essentially, a person's on hyper alert or high alert for danger or threat following the trauma. So these are characterized by symptoms like irritability or anger, reckless or self-destructive behaviors, hyper-awareness of their environment, hyper-awareness of surroundings, an exaggerated startle response, concentration difficulties, sleep problems. So that's kind of the quick rundown through the what part of the anxiety disorders. Now I want to talk about the stuff that I actually find more interesting, which is the how. How do these anxiety disorders work, and what are the common mechanisms that underlie these anxiety disorders? Because if you just look at them on their surface, they look quite different from one another. The only thing they seem to have in common is that they're associated with anxiety. OCD looks very different than PTSD. So what are the commonalities between them other than anxiety? And so if you understand how anxiety works and how these anxiety disorders work, you actually see and realize that the mechanism behind all of these conditions is essentially the same. They work all in the same way. And that's what I want to work through in the remainder of our time together, is talking about what are the mechanisms by which these anxiety disorders work and how do they work. So the four things I want to talk about that sort of the commonalities between all of these conditions are they all involve a particular feared object, situation, or thought. They all involve avoidance. They all involve what I call safety behaviors, and I'll get into what exactly safety behaviors are. And they all are characterized by beliefs that tend to maintain the fear and the anxiety. So let's start with the feared stimulus. So what is it that people fear in each of these conditions? Well, in specific phobias, it's the object of the phobia. So I fear dogs, I fear clowns, I fear heights, I fear spiders. In panic disorder, the feared stimulus is the physical sensations of anxiety. In social anxiety disorder, the feared stimulus is the social situations that a person is afraid of. Public speaking, dating situations, going to parties. In generalized anxiety disorder, the feared stimulus is uncertainty. One way of thinking about generalized anxiety disorder is that it's almost like a phobia to uncertainty, a phobia to the unknown. In obsessive-compulsive disorder, it's like a phobia to the intrusive thoughts, images, or impulses. PTSD, the feared stimulus, is the trauma memories. So if you think about just a simple phobia or specific phobia, you can use that same principle for all of the other conditions. It's a phobia of uncertainty. It's a phobia of physical sensations of anxiety. It's a phobia of the intrusive thoughts. It's a phobia of the trauma memories. And so I want to talk about avoidance and how avoidance fuels all of these anxiety disorders. And so what I want to talk about is what I call the avoidance-fueled roller coaster. And think about what happens when we encounter the anxiety-provoking stimulus in any of these conditions. So let's start with specific phobia. I have a phobia of dogs, terrified of dogs. I walk into a room and there's a really big dog in that room. What happens to my anxiety? It goes up. It gets really uncomfortable. I'm really scared. Maybe I'm even panicking. So what am I tempted to do? I'm tempted to push a button. There we go. I'm tempted to avoid or escape the situation. So I'm in the room with the big dog. I feel really anxious, and so I get out of the situation. Well, what happens to my anxiety when I get out of the situation? Well, it goes down. Well, golly gee, that's great. This avoidance stuff works awesome. I was in a situation, my anxiety went up, I avoided the situation, I got out of the situation, my anxiety went right back down. That's fabulous. So the avoidance actually gets reinforced because it feels good to have that reduction in the anxiety. The problem is, what happens the next time I'm walking down the street and a dog is approaching me coming down the sidewalk the other way? What happens to my anxiety? It goes up. So what do I have to do? I have to avoid. What happens to my anxiety when I avoid? It goes down. Okay, that's good. The next time I encounter a dog, my anxiety goes up. So what if I learn to do when my anxiety goes up? I learn to avoid, get out of the situation, and my anxiety comes down. And so the avoidance is working really well in the short term to help reduce my anxiety, but it's doing nothing for me in the long term. And it's just perpetuating my anxiety. So I'm on this avoidance roller coaster where the anxiety is not going away. The only conditions under which the anxiety is going away is that I avoid or I leave the situation with the feared stimulus. This applies not just for the specific phobias, it applies for panic disorder. Think about it with panic disorder. I'm in a situation, I start to feel my heart begin to race or begin to accelerate. So what am I tempted to do? Do something to try and calm myself down. Get out of the situation, drink a glass of water, try to do some deep breathing. Maybe I have some Ativan, so I take an Ativan. That's all designed to make those physical sensations go away, to avoid those physical sensations. So my anxiety goes down. That feels good. But the next time I'm in that situation, the exact same thing happens. Think about PTSD. I'm in a situation where I'm exposed to a trigger of the trauma. What happens to my anxiety? It goes up. What do? Have a drink of alcohol. Get out of the situation. Go home. What happens to my anxiety? It goes down. But the next time I'm exposed to a trigger, the anxiety goes up. And so you get on this roller coaster that you're really not getting off of. And the only way the anxiety is being managed is through avoidance, which, like I said, works well in the short term, but is actually maintaining the anxiety in the long term. And to add to it, you're only feeling safe as long as you're doing those avoidance behaviors, which can be extremely limiting in a person's life. So your world tends to get smaller and smaller and smaller as you constantly have to avoid to feel safe or to reduce or avoid or eliminate the anxiety. So this avoidance-fueled roller coaster doesn't work. It doesn't help in the long run, and it actually perpetuates the anxiety. So avoidance works really well in the short term, but it perpetuates and maintains anxiety in the long term, in part because you never get to experience what would happen if you didn't avoid. So what would happen if I stayed in that room with the dog and didn't run away? Would my anxiety continue to escalate to the point that my head popped off? Would I get so anxious that I would pass out? Would I have the mother of all panic attacks, lose control, go crazy, and never come back from it? I don't know, because I won't allow myself to get to that point because the avoidance allows me to get out. But I don't know what would happen if I didn't get out of that situation. What would be the worst thing that took place? Would it be catastrophic? I don't know. The avoidance prevents me from really seeing what happens and how much danger I'm actually in. Which leads us to safety behaviors. And safety behaviors, a way of thinking about them is they're kind of a more subtle form of avoidance. Safety behaviors are anything that a person does in order to help make themselves feel safer, but may not have any substantial impact on actually making them any safer. So, for example, specific phobias. If I have a fear of motor vehicle travel, I may leave 8 car lengths between me and the car in front of me because it just feels safer. Just in case that person stops suddenly, I'll have extra room in order to stop in time. Whereas, is that actually making me any safer, or would 4 car lengths be just fine? In panic disorder, I'll avoid drinking coffee because coffee gets my heart rate going, and maybe if my heart rate gets going too quickly, I'll have a really bad panic attack and it'll lead to a heart attack. Well, what's the probability that drinking coffee will actually trigger a heart attack? Not that much. It's a very low probability. Yet avoiding coffee isn't actually making me any safer, but it helps make me feel safer. Social anxiety disorder. I'll wear clothes that aren't too flashy, that really blend in so nobody notices me. And if nobody's noticing me, then I'm less likely to have social interactions. And if I'm less likely to have social interactions, then people are less likely to judge me negatively or less likely to do something to really embarrass or humiliate myself in front of other people. Even though the probability of that may be small, wearing bland or blending in clothes doesn't actually keep me safe. Generalized anxiety disorder. If one of the things I'm worried about is that this person's going to be really upset with me if I disagree with them, and that would be really horrible and catastrophic, and they'd attack me, and I wouldn't be able to manage it. So, you know what, I'll just be very agreeable with people and get along, or try to get along with everyone so that no one will get too upset with me, and that would avoid being totally shunned socially. With OCD, one of the ways of thinking about the compulsions are they in and of themselves are safety behaviors, right? So I touch the doorknob, I feel my hands contaminated, I go and I wash my hands. Well, now my hand's no longer contaminated, I'm safe, I'm not likely to poison myself or anyone else. well, it was highly unlikely that touching the doorknob was actually going to make me terribly sick or poison anyone. So washing my hands hasn't actually made me any safer. PTSD, if I have PTSD, I go to a restaurant, I'm going to sit with my back to the wall, and I'm going to keep an eye out for all of the entrances and exits to the restaurant so I know who's coming in, because I want to be on the lookout for people who may be dangerous or who may be threatening. Well, yeah, you may be able to identify people who are dangerous or threatening earlier on, but how often does that actually happen? So how much safer is that safety behavior actually making you? So you may sort of question me and say, well, Rami, if these things are helping a person feel better, if they're helping a person feel safer, what's the big deal? Well, so what? Let them leave 8 car lengths between them and the car in front of them. What's the problem? Now, to explain the problem of safety behaviors, I like to use this metaphor of the rock that keeps the aliens away. Now, suppose I have this terrible fear of aliens. I'm really scared of them. Maybe not this guy, he's cute, but I'm terrified of aliens, and I'm terrified that every time I leave my house, I go out the front door, I fear that I'm going to get abducted by aliens. They're going to take me up into space, probe me, and do all sorts of unpleasantries to me. And that terrifies me. But one day, I come across this rock. And for whatever reason, I believe that this rock has magical powers. And the magical powers of this rock are that the rock keeps aliens away. That this rock in and of itself protects me from aliens. So as long as I'm carrying the rock, I won't be abducted by aliens, they won't come and get me, and I'll be safe. So every time I leave my house, I carry that rock with me. And lo and behold, I don't get abducted by aliens. The rock works great. But suppose one day, I'm kind of preoccupied, my mind's on something else, and I leave the house, and, that the rock keeps the aliens away. I leave the house, and I don't have my rock. And I go about, and I do my activities that day, and I get home, and I realize, oh my goodness, I forgot the rock at home. But wait a second, I wasn't abducted by aliens. Well, maybe they were just patrolling a different solar system this day, and maybe I just got lucky. Or, maybe I can try to be a bit courageous about this and see what would happen if I were to go out again another day without the rock. What would happen? And I go out another day, and lo and behold, I'm not abducted by aliens. And I do it again and again and again and again and again. By the 1000th time I've left my house and I'm not abducted by aliens, what do you think has happened to my fear of being abducted by aliens? It's gone away. I'm not afraid of being abducted by aliens because I go out all the time and I'm not abducted by aliens. So the problem with carrying around the rock is that the rock actually maintained my fear of aliens. Because as long as I was carrying around that rock with me, I didn't know whether it was the rock that was keeping the aliens away and keeping me safe, or if it was the fact that there are no aliens and I don't have to be afraid of being abducted. So the idea is the rock doesn't have any magical power. But as long as I carry that rock with me, I'm telling myself, and I'm behaving in a way that's telling myself that there is danger and that there is threat. But as long as I stop carrying that rock, I come to learn that I don't actually have to be afraid of aliens, and the rock is just a rock. So that's the problem with safety behaviors. Safety behaviors maintain the fear because by engaging in those safety behaviors, you don't know what's keeping you safe. You don't know if it's a safety behavior that's keeping you safe, or if it's the fact that the world isn't as dangerous as the anxiety is telling you it is that's keeping you safe. So these safety behaviors maintain the anxiety because you're behaving like you have something to be fearful of. And that leads us to sort of the last commonality between the anxiety disorders, and this relates to beliefs that maintain anxiety. And in the anxiety disorders, there tend to be two sort of common sets of beliefs that tend to perpetuate anxiety. The first is that people with anxiety tend to overestimate the likelihood that bad things are going to happen. So someone with a phobia of air travel, they may tend to overestimate the likelihood that if they get on a plane and fly to Toronto, that that plane is going to crash. And they'll be killed in the plane crash. And so ironically, what they do is they decide to drive to Toronto. Well, statistically speaking, they're way more likely to be killed driving to Toronto than they are taking a flight. But again, with anxiety, people tend to overestimate the likelihood that the bad thing is going to happen. It's highly unlikely. If I've had 1,000 panic attacks in my life, and I start to feel another panic attack coming on, I may think, oh my goodness, this is actually a heart attack. Well, probably not. It's probably just like all the other times I've had a panic attack, and it was just a panic attack, not a heart attack. So people tend to overestimate the likelihood that bad things are going to happen. And the second thing is that people tend to underestimate their ability to cope if bad things happen. It's almost like I have social anxiety, and I'm going over to ask that girl out on a date. And so I go over to her and I ask her out on a date, and she politely says, no, thank you, I'm not interested. My anxiety is telling me that is going to be utterly devastating. There's no way I'll recover from that. I'll feel terrible. There's no way I'll manage. I'll get terribly depressed. I'll never ask anybody out on a date again. So the combination of these two types of beliefs. One, I tend to overestimate that bad things are going to take place, and when bad things do take place, I lose all capacity for problem solving, all capacity for coping, all capacity for managing, and it's going to be an utter catastrophe. And so if you hold these types of beliefs, that's really going to fuel those avoidance and safety behaviors that I talked about, because the world really is dangerous and I'm not going to be able to cope with it. And so I have to do a lot of avoidance, and I have to work really hard to keep myself safe, which then undermines my views and my perceptions of myself, my ability to cope, and it reinforces these negative beliefs about anxiety, and you just enter into a really nasty spiral where the avoidance is maintaining these beliefs, which then in turn maintains the avoidance. Think of anxiety as a greedy disorder, as a greedy emotion. That anxiety will get you to think and behave in ways that perpetuates the anxiety. So when you're feeling really anxious, what are you tempted to do? You're tempted to avoid a situation. Well, avoidance is just going to maintain the anxiety. When you're anxious about a situation, the anxiety is going to tell you something bad's really going to happen. Well, thinking that something really bad's going to happen is going to maintain the anxiety. So anxiety is nasty that way. The things that you're tempted to do, we often hear the term, follow your gut. In anxiety, following your gut is what gets you into trouble. It's what the anxiety wants you to do, and it's what perpetuates the anxiety. And so in conclusion, I want to point out that the anxiety disorders may look very different, but they function in very similar ways. There's a feared situation, object, intrusive thought. And avoidance is the key to maintaining those anxiety conditions. So obvious avoidance, but also those use of safety behaviors. What the avoidance and the safety behaviors does is it prevents a person from really evaluating what the real risk or danger is, and it tends to undermine a person's confidence in their ability to cope and in their ability to manage. So hopefully that discussion has made some sense to everybody, that I was sort of able to pull these different types of anxiety disorders and demonstrate how they tend to work in very, very similar ways, despite the fact that they may look different on the surface. If you want to learn more, I encourage you to like us on Facebook. The North Shore Stress Anxiety Clinic has a Facebook page. We're updating it every day with information and articles, just as a way of continuing the dialogue and continuing to get information about anxiety, depression, mood conditions out. So you can like us on Facebook. You can subscribe to our YouTube channel. I will be posting this talk on YouTube at some point in the next few weeks, but all of the previous talks are posted on YouTube, so you can take a look at some of those talks. I did a talk here a couple years ago on generalized anxiety disorder. It's been on YouTube for a couple of years. It has almost 60,000 views. And it's just a talk of my slides and my disembodied voice. So it's not really anything that exciting or interesting, but it just goes to show how much of a thirst there is for this type of information out there. You can check out my website. You can also check out the North Shore Stress and Anxiety Disorder Clinic website as well. And if you're interested in anxiety, I strongly, strongly recommend the Anxiety BC website. As far as I'm concerned, it's one of the best websites on there for information about anxiety and anxiety disorders. So that being said, are there questions?